if you have any questions or comments. Okay, something just popped up in front of me here. Ross is going to be monitoring the chat. We have a video for you. We thought that this would be a good way to kind of give you an overview of some of our takeaways from the listening sessions that occurred this past fall, and also let you know a bit of an update of where we are on a continuing needs assessment here. It's about 20 minutes long, and that also will hopefully give us all some time to hear from you, your feedback on our takeaways, and to share kind of what's going on now, some thoughts that you might be having, and some reactions and comments on what we're presenting to you. So I'm going to do that now. We're all going to kind of take some notes here as well during the discussion, just so you know. And if you give me just a moment, I will try to get this up on my screen. Thank you for joining us for this brief update on Princeton's 2020-21 Community Needs Assessment. This presentation is a summary of listening sessions with community partners initiated by members of the Human Services Commission last fall to gather input on Princeton's response to the broad range of needs that arose during the pandemic. Commission members and others who participated in this effort include Christina Gonzalez, Monique Jones, Ross Wishnick, Veronica Oliveras Weber, and John Heilner, as well as myself, Erica Deglow. Special thanks to Melissa Urias, Director of Human Services for Princeton, whose help was invaluable, and to Melissa's MSW intern, Daniela Molina. Most of all, our thanks to community partners for your valuable input.
As you may know, over 6 years ago, the Princeton Human Services Commission conducted a needs assessment designed to capture the experience of community members, particularly those from lower income households. The decision to revisit and update this needs assessment for the current moment actually came up several months prior to the appearance of COVID-19. Contrary to the 2014 needs assessment, our focus was to center on service providers to ensure that the important voices were heard and to explore issues of common experience and concern. Our guiding question was how we, as a community, could both strengthen and coordinate efforts to meet the needs of our community members, particularly our lower income residents. We hope to look at what we were doing well, what some of the gaps might be, and what we could strengthen in our work. With the onset of COVID-19 and the increased challenges that many of our community members were facing, we realized that conducting a needs assessment was more important than ever, and that we needed to specifically consider emerging needs related to the pandemic. We thus wanted to focus on 4 broad areas: housing and security and basic needs, employment and childcare, children and youth well-being, and health broadly, including mental health, spiritual health, and addiction. Between October and December, we held 8 listening sessions over Zoom with the participation of over 42 community partners who were involved in service provision and advocacy during this most challenging of times. During these sessions, our community providers shared much information with us about their work, about the challenges that their service populations had been facing, about the ways in which they had adapted to pandemic circumstances, and about the expansion of need in many areas, particularly those members of our community who had just recently found themselves newly in need due to the crisis. What was evident from these conversations is that Princeton has a rich and wide array of service providers, all of whom are doing excellent work. However, we also found that communication and collaboration among providers could be bolstered, particularly as they work to meet the complex array of needs under the challenging new circumstances imposed by the pandemic. The pandemic has exposed ongoing gaps in resources, but it has also exposed emerging ones that are likely to continue into the future. And here, as elsewhere, our most marginalized populations have been disproportionately affected by these gaps.
Okay, we're going to now move into the area of external communication. And this is referencing the connection to or connecting with those in our community in need of the services. Starting with our strengths, as many of you are already aware, Princeton, we have a multitude of service providers. And thankfully, a number of you have mobilized, expanded, extended your services during the pandemic to address those ongoing and emerging needs. And with that growth, with that expansion, that extension, we saw that many providers also used a variety of communication platforms. Some of those being former ways of communicating, but also tapping into new ways. And that has included everything from WhatsApp and websites to flyers and door knocking. One of the challenges that came up, or a couple of the challenges that came up in the discussion, was that there was still difficulty, even with the communication formats and tapping into new ones, that there was still difficulty to identify those in need. And so that being connected to barriers to communication, and that has included the areas of language, culture, literacy, internet, and the access to the internet, and even location. And so some of the needs and opportunities that came out of our discussion with you all was one, establishing a best practices. And so a notated way or most effective means to communicate, to reach those in our community who are in need of our services. Also a centralized database or calendar to help facilitate referrals and linkage to services. And then also a way in which to share data without infringing upon privacy, as we know that is something critically important that we maintain and hold on to. Let's now move into the theme of or connected to internal communication. And this differs from the prior slide in that it is referencing specifically coordination, communication amongst service providers themselves. And out of our meetings and conversations, this was a theme, this internal communication theme was something that came to the forefront. And so once again, reiterating, right, we know we are aware of Princeton's robust number of service providers who provide services to our Princeton community. One of the challenges that came forward is that because of this robust and high number of service providers, there is sometimes an overlap in both client population and resources. And so some of those needs and opportunities that came out of that discussion or came forward is that one, needing a way to coordinate external communication, right? So in order to address issues that are related to that communication, right? Possibly a centralized channel of communication that could help benefit service providers and those in need of those services. Also a mechanism or a meeting through which service providers can collaborate. And so if there's this large number and if there's overlap, how do we better communicate? How are we more effective in meeting the needs of our community? And then lastly, a dashboard to help identify and resolve any unmet needs and gaps in services. Moving next into the area of mental health and physical well-being, looking first at our strengths. One of the things that came up in our conversations is that local providers are meeting the pressing mental health care needs. And so the robust number of service providers in our community are there. They are addressing those. And even with the limited or even miscommunication that may happen amongst service providers and institutions, as discussed in the previous slide, there is some form of communication and coordination that is happening between service providers and institutions such as schools and churches. And then just reiterating that was shared earlier, many service providers, many of you all all have extended and expanded your services to meet the growing needs that we have seen in our community. Now, on the flip side of that, the challenges that are connected to those strengths, one is that the growth of services by organizations, while extending and expanding the reach, the support from providers, that has not been accompanied by an extension or expansion of resources when providing those additional services. And so that adds an additional level of burden or stress to the service providers. Also, too, one of the challenges that came up that we heard is that there has been an increase in life stressors and social isolation. And so with both of those comes then an increased need for mental health support. The lack of in-person social outlets that we saw, and thus the disconnect from familiar channels of social interactions such as schools, churches, recreational activities, led to a growth of frustration, growth in isolation, and growth in needs and of support and intervention, oftentimes or sometimes going unidentified and or unaddressed. I think it's also important for us to note that the social isolation piece is a primary concern for our seniors, for our youth, and our caretakers. And what was shared is that was even further exacerbated by unfamiliarity with and inequitable access to technology to even tap into those services or get connected and communicate the need for them. One of the other challenges is that organizations are having more to do with less. And so they have been creative or had to be creative in finding new ways to maintain relationships with those in needs of services. So really going back to the extension of services, but not having resources to help support that expansion. Also, one of the other challenges that was shared is that families with financial strains that we saw over the pandemic and economic dislocation has forced families to prioritize their basic needs, right? So we go into survival mode, which means mental health falls to the bottom of the list. And so that gets shortchanged. And then also just the continual need for physical health care, dental and vision, that all of that still remains problematic for our under-resourced members in the community. I think also too, just adding to that kind of list of need and opportunities. So increasing that greater focus on dental and vision care as previously mentioned, increased support for providers, more mental health support due to that, due to the life stressors and isolation, but also that advocacy piece, which is very important, especially for those in our community that may be overlooked or their voices may not be heard. And so it's important that advocacy and the increase of that is something that is addressed as well.
The category is basic needs, including food, utilities, rent, etc. Strengths. There are a number of organizations in Princeton providing services previously and expanding to meet new challenges as a result of COVID. Food programs are more coordinated and meet regularly. Princeton Mutual Aid at the university started during the pandemic, providing grocery deliveries, monetary and non-monetary support, such as repurposing computers, furniture, etc. Challenges for the and underserved populations. Needs have been more dramatically exposed as a result of the pandemic. The provision of daily necessities have been in greater demand. Working within COVID constraints has been certainly challenging. Pronounced exposed needs include rental and utility assistance, finding solutions to the end of eviction moratorium, home and car repairs, childcare, healthcare, and many needs of the undocumented community. The category is professional support needs. Identified strengths suggest that schools and available childcare have expanded outreach, access, and programming, of course, within COVID constraints. Identified challenges. For many, the economic impact from the pandemic has been devastating. Job loss, increased childcare needs, and professional support needs. For children and students, loss of in-person learning and need for more and effective technology has resulted in teaching and learning deficits which will be difficult to make up. Needs that have been exposed: identify and create tools for job seekers, job retraining, childcare and supportive resources for parents, help students and parents regain the educational losses due to COVID, identify and or create support for frontline workers and caregivers resulting from the stresses and losses due to the year of the pandemic.
Transportation, technology, and other amenities. Access to transportation and technology have become critical drivers of inequity during the pandemic in education and learning, obtaining needed services and staying safe. Ensuring that families, children, and the elderly have necessary access to these critical amenities has become an important part of the work of services providers. On transportation, there was a reduction in public transportation as well as in existing routes that diminish access to higher education, food socialization, among others. Challenges exist in organizations on obtaining transportation to medical appointments for seniors and the disabled during the pandemic. Bus transportation to and from school, particularly for extracurricular activities, continues to be a challenge for some children, reducing access to needed enrichment activities as well as others. On technology, access to technology has improved due to the efforts of the municipality, the public schools, and individual organizations and funding sources. However, there is some challenges on internet speed. There are areas with limited Wi-Fi access who have problems with connectability, and there are some challenges in using technology for some in our community, as well as access to broadband and to devices. Diversity and inclusion. Princeton has many resources and a commitment to diversity and inclusion. However, we have many challenges. Language, culture, and legal status can be a barrier to accessing services. Members of our community may feel excluded or have unmet needs. There exists tension between different communities in Princeton. On needs and opportunities, diversity and inclusion resources for employers and services providers and opportunities, and more training development needed to combat racial justice.
More than 40 service providers and activists who serve Princeton residents participated in our listening sessions, and we are grateful to you for your continuing work and for sharing your time and perspectives with us. We addressed many overlapping areas, but were able to address both the pressing needs for social and emotional support, the challenges of social isolation, and basic needs of children, youth, older adults, families, and individuals. As these listening sessions were underway, we began to develop a survey to broaden our information gathering. The survey built on some of the questions that were asked in Princeton's 2014 needs assessment and on the topics discussed during our listening sessions. We sought to gather additional perspectives on changing demands and access to services during the pandemic, as well as on emerging needs, and to get a sense of provider challenges in their outreach and in meeting these needs. Princeton University Survey Research Center helped us to refine and administer the survey. We received outreach help from several Rutgers MSW interns, and Oscar Torres Reyna of the university is currently analyzing the survey results. We expect the analysis will be completed sometime this summer, at least in draft form, and we'll be sure to share with our partners.
Based on the information that we gathered during these listening sessions and your feedback, we have several potential action steps in mind. First, we will complete the analysis currently underway of the needs assessment survey, and we will begin to consider how to best convey these results and make them available to the community. We would love your ideas on how to best and most effectively do this communication. We thought perhaps a dashboard of the results might be a good first step. Second, we want to work to consider how to best support or initiate work groups meetings, or other forms of collaboration between the various service providers. Third, we have begun to consider a second phase of the needs assessment, directed to individuals and families who use or who are in need of services, something that will be certainly more manageable as we begin to exit the pandemic and can have more direct communication with our community members. Before we move on to any next steps, however, we wanted to create an opportunity for discussion, a chance for everybody here to provide their feedback on the information that we've gathered so far. We would love to learn about anything we may have missed or anything that we need to expand upon, or if you think there might be anything that needs to be corrected. In addition, we're now several months distant from the beginning of the pandemic, and we are hopefully beginning to see an end in sight. We would love your insight onto how things have changed in the last few months, on what we might need to anticipate in the coming months and years. All of this information would be most helpful. We'd also love to hear more from you about how you might use the needs assessment and how we can make this information readily available to anybody who might benefit from it. Thank you so much for your time. We look forward to hearing from you in discussion.
Okay, thank you. So we'd really like to turn this over to members of our community and our partners on responding to what you've seen, adding anything that we might have missed, sharing with us what things are like now, and how you might use this needs assessment if you see particular ways to that you might be able to use both the information here that we've shared with you, but hopefully also when the fuller needs assessment becomes available. We can use the hand sign if you'd like to, or you can just start to raise your hand. Go ahead, Leticia.
Erica, I wanted to first say thank you so much to you and everybody else who worked on this. I think this is, I know your work isn't done, but it's definitely a wonderful start. I think one of the issues that you've highlighted that I think it's something that we've been struggling with ever since I can remember is that we know that there are resources available, but only either those that are most savvy or have someone who's advocating on their behalf is going to have access to them. So what I'm really interested in, you know, that's just one part of it, but I'm really interested in figuring out and working out how we're going to do better outreach, either through communication or find alternate forms of communication. I'd like to see what other communities are doing as well to reach our underserved populations, because I think in hearing, especially like in the food insecurity task force, there's often talk, the resources are available, the food is available, but very often it's sometimes in abundance, but we know for a fact that there's families that could use it and are not getting it because they don't know about it. Mm-hmm. So I think that's the main, one of them, I wouldn't say the main, but one of the main issues that we need to tackle. But thank you again to you and everybody that worked on this.
Thank you, Leticia.
Any other thoughts?
Erica,
Yeah.
you know, I was, I did send you a text, but I'm thinking that there's, in addition to requesting information input today, that there's so much information on this video, including the PowerPoint that's behind it, that making it available for others to see it, everyone here to see it, and, you know, at their own time frame, perhaps also react.
I don't know, Melissa, if you think it's possible to post video on the website. That might
I'll double check, but I think so. And I can also send out the link to the recording and the
Okay.
presentation.
Yeah, there was quite a lot of information. And I think at the end of each of the listening sessions, we sent out kind of a summary of what occurred in that particular session. And what this represents, along with kind of an initial write-up that members of the committee did for the commission, tried to pull together the common themes of those listening sessions. So if you went to one, you didn't hear what happened at the other. And while it's not a play-by-play of what occurred at the listening sessions, what we tried to do is pull out some of the common themes there.
I think, Lenora, can I put you on the spot a little? And you see and have seen over the years a lot. And do you have some reaction to this?
Well, first of all, I think it was very well done, and I think the information is helpful. And there was a lot of overlap in terms of resources. The mental health piece, of course, continues to be a very important piece. We still have a lot of students and families struggling on many different levels. Sometimes students and families you wouldn't even think are struggling are. There is still a need to, I think, make more mental health and counseling services available at a reduced cost to families and students. So that continues to be a need. In terms of the food piece, we have over the past year had a lot of resources come together to help provide food and things, and many of those are still up and running, thankfully. But I do agree that there are still some families who may not know how to continue to tap into it, because I think last year there was just a lot of us kind of on the ground, kind of making calls, checking in, knocking on doors, emailing, texting families to make sure they have. So not necessarily doing this much of that, at least from my end. I can't speak about what others are doing. So, I mean, there are certain populations of people that I check on a more regular basis. And so but I think our senior citizens continue to want to make sure we don't forget them in the midst of everything. But I know there's a strong group of people out there advocating for them as well. And I think just preparing our students to come back to school in the fall, provide those resources. There still continues to be some Wi-Fi issues and technology issues for families in town. So to continue to work on those issues and to check in with people as well. It's probably more, but that's all I can think of for right now.
Just a quick question. Do you think, in what you see, that people who have found themselves newly in this position have a particularly difficult time?
I can't speak for all, because I've, obviously not been in touch with everyone, but there are some who have struggled a little bit more if they're not used to some of the being without a job and having to do with limited finances and not able to do some of the things that were so easily to do before without much of a thought, but because finances may have been cut off because of job loss or decreased hours. There's, I think, have added some added pressures in the home. We've seen some increase in terms of domestic violence or abuse, drinking, alcohol use, which of course we all know can lead to other problems and issues within the home. So some of those issues are still there and may have kind of multiplied, I think, across the board. So there are still lots of struggles.
Thank you, Leonora. And I would like also to put Trinidad on the spot, since I know she does a lot of work with the families in our community. Is there anything that Trinidad would like to add in addition to, because you guys are serving different populations?
Yeah, and we work well, and we work together as well, Trinidad and Liliana and I.
Yeah.
Right. I think it's great too that the community is coming together and forming different, like for instance, the Pride Picnic on Saturday at the YMCA, something that would help not just the students, but the adults. I think it's great just to have more things like that. And also the Black Parent Group, the award ceremony that's coming up on June 9th. Just to have more positive things for our families in the community, I think will help make a difference.
Can I get the name of the student one more time?
Okay.
Thank you, Trinidad.
I'm wondering if anyone might comment a little on some of the mental health issues that Lenora brought up. And I think Trinidad, in a sense, bringing up supportive community activities, right, as these events that are coming up. How do you foresee all that evolving as we kind of move towards being back in school for kids? Things are changing. Hopefully things will be getting better. But how do you see the need that has developed and maybe has not been addressed for some people in terms of mental health counseling support?
That's just kind of an open question for
I was going to
you.
say, yeah,
An open question, both to you, but also to anyone else who perhaps has taken note of this issue. Because I think one of the things that we noted is that, you know, the basic needs were so dire. And even some of the mental health professionals who spoke during our listening sessions were, you know, there is this need, but families themselves tended to put the mental health needs in last priority, right? Because they had to take care of survival first, right? And so you spoke a little bit about needing more resources in terms of mental health, just in terms of recognizing the importance of taking care of our mental health well-being as we move into kind of a new phase here.
Erica, could I
thoughts on how to do that?
could I suggest that Gary might have some input on this?
Oh, I'm sure.
Well, I think Leticia was waiting for, Leticia was raising her hand.
Okay.
Well, I mean, and Gary too, I'm sure, but no, I just wanted to share with you that there's actually the Youth Advisory Committee formed a subcommittee soon after COVID hit, because, you know, they're right in the midst of it, and they are very aware and talking about the mental health issues that have been, you know, they were already back from middle school acknowledging that that our students were experiencing often experience issues of isolation, bullying, especially new with social media that enhance sometimes some of what they were experiencing. But then during COVID, the isolation, they actually formed a subcommittee on mental well-being and have been working to address those issues. There's a student group that they've joined called the Greater Princeton Mental Health Coalition. And they're going to be, they've reached out already to our health department. And I thought I saw Jeff Grosser. Yeah, I saw Jeff Grosser here earlier. They've reached out to the chair of our health department to expressing an interest in meeting to see if there's any way that they can collaborate on what resources might be available. Like I said, because even, you know, they're very well aware of what their peers are experiencing and are interested in addressing it. And we're here to support
them.
them.
Let me jump in here with some information. Yeah, everyone knows that mental health issues post-pandemic are out of control. The need for resources across the country for mental health resources is significant. We're seeing that in Princeton. The 250 kids a week that we work with in our outreach and leadership programs has made us well aware of addressing the needs, and we've expanded all of our programming to address the needs for those students, and still needs to be expanded. We are looking at a collaboration corner house with the health department in expanding mental health and physical health needs for the community, and expanding corner house to be able to be licensed for providing mental health services, and the health department expanding their physical health, and actually putting a proposal together that would be a joint effort that Jeff and I and David have been talking about, that could really meet the needs of the people in our community who don't have the resources. It's difficult enough to find mental health practitioners if folks have resources right now. Most practitioners are not taking insurance, and so it's almost all cash pay. And the majority of the people that, corner house serves, health department serves, human services, are people without resources. And so we're really looking at an approach to provide those mental health resources for individuals, adolescents, young adults, families, because the need is so high. And the information that you've come up with in your needs assessment will help bolster, I think, the plan that Jeff and I and David have been talking about. Jeff, do you want to jump in there?
No, yeah, thanks, Gary. No, I'm really excited to be part of the process. Back in 2014, the last time this was done, I had just started actually working for Princeton, and I was able to work with Elisa at the time on the needs assessment. The one thing that we noticed back then was the beginning of what we were seeing with undocumented new Princeton immigrants that were in need of pediatric services to gain entry into school. And sure enough, that's kind of been our focus for the last 4 or 5 years. And we've expanded that now to the Capitol Health Family Medical Practice on Witherspoon Street, was just opened, and we're trying to expand coverage there. As Gary mentioned, the combination between physical and mental health, the one thing that we've noticed, especially through the pandemic, is that there is a huge disconnect with regards to something we call patient-centered medical homes. And what that is basically, we all think of a primary care physician as being something we don't even think about, but we take it for granted. There's a number of adults in Princeton right now that don't have a medical home. And what that does is they're not referred out for services beyond primary preventative care. So as part of that proposal, our goal is to fill a major void, which is lack of preventative care and a medical home for uninsured or underinsured Princeton residents, and putting one where it's within walking distance to take out the transportation barrier on Witherspoon Street. So, but not just giving them, giving a contract to somebody and walking away, but collaborating to make sure that our services are aligned. And although sometimes duplicated, they're working together to try to start solving some of these larger scale issues, because adult preventative primary care is extremely expensive. And we want to make sure that we're filling the void, not just getting that preventative care, but then also assisting with follow-up and specialized services. And actually, one last thing, I just want to thank you, Erica. Thank you, Human Services, because the data and the input that you receive on this needs assessment, I know Gary utilizes it. The health department also utilized it in 2014 as part of our accreditation process. And we continue to utilize it for our day-to-day operations and trying to move different services around to where it's most needed.
I think it's great to hear of this connection of health and mental health services, because that's where things often, I think, break down in both areas. So it's wonderful to hear that that's happening. Is that also including children and youth? I'm imagining yes, because Jeff, you spoke of adults, and Gary, you were speaking a little bit about your youth.
Yeah, so it would definitely cover youth, adolescents, adults. We're seeing the whole families are struggling, and all members of those families. So we're providing as many services as we can to youth at this point, and expanding what we can within the confines of what it is that we do currently in the community. But the need continues to grow on a daily basis. And we're seeing that even with families who have means are having very difficult time in Princeton accessing mental health services.
Yeah, for physical health for children, it's required to provide preventative care services for children 0 to 6 years old. In Princeton, that's been expanded to children through 18 years old, again, as a result of the 2014 needs assessment. So those services are provided, but there's a lot of good movement from the state level that looks like it could potentially happen where potential for the state approving the state-funded Medicaid for all children, regardless of immigration status. If that were to happen, we would actually have a sizable amount of already appropriated funds for children. We could actually reappropriate for older adults and actually get, or adults rather, and older adults, and get started on that process. And that looks like that could be happening as early 2022.
And along with that, the state is also considering having a singular license for substance abuse and mental health services, which would allow us to expand into the provision of mental health services, since we're a licensed substance abuse ambulatory care facility, and that would provide the ability to reach out to a lot more people in Princeton with the mental health access.
So Gary, but you're not providing.
We're hoping that the state allows that to happen next year. Currently, we don't provide straight mental health services. We provide substance abuse services and services for co-occurring. So if people have a substance abuse issue and a co-occurring mental health issue, we provide services to them.
So how do you, I'm just curious, so how do you provide the mental health help to the people that you're serving, right? Because it's mostly focused on substance abuse. So do you have any resources at the moment?
Yeah, most of the people that we serve have a co-occurring mental health issue. Probably 90% have trauma issues. We have our clinicians are specialized, trained in state-of-the-art EMDR treatment services for trauma. We have all of our clinicians to train and working with both substance abuse and mental health, but it has to be in the context of our license, which is substance abuse and co-occurring mental health. So we're hoping the license gets expanded. The state's been talking about it for a couple of years, and that if it gets expanded and we can add mental health, because we are a Medicaid provider, and we could also approve people for Medicaid through our system, it would really open up the spots for a lot of additional families in need in Princeton. And we also do have bilingual services at this time for substance abuse and co-occurring mental health.
Thank you. I was just, curious, and I don't want to take over, Erica, but I would like to hear from Michael, because Michael from the YMCA, he also worked with the youth. So I would like to see what he, anything that he would like to add.
As far as providing mental health services?
Can I jump in real quick? I'm sorry, Veronica, can I jump in? I wanted to follow up to Gary, which I think will be helpful to the group. Gary, this is a continuation of Veronica's earlier question. What happens, I think just for the sake of the knowledge of everyone here, what happens if there is, in Princeton, if there is no occurring issue between substance abuse and mental health with solely mental health? Since Cornhouse, we deal mainly with the substance abuse and can deal with the mental health. Health is sort of like an extrapolation from the substance abuse. What happens when there is mental health without the substance abuse?
Well, we do refer out, to Trinity Counseling, to other agencies in town that have resources for mental health. If it's a straight mental health issues, we probably get 2 to 3 calls every other day for mental health, straight mental health services. And so we're making referrals almost on a daily basis for mental health services to other organizations in town, to individual therapists, if people have the resources. And it becomes challenging, especially for families that don't have the means or the resources to find services in this area for mental health.
Not sure if anyone on this call is from Trinity Counseling, but a lot of our families are helped by Trinity Counseling, and a lot of our families that are on the meal program, they receive help for free. And if they miss any sessions, then there's a fee for that. But any families on a meal program, does get counseling services for free.
Yeah.
Okay.
Trinity,
Thanks, Gary, and my apologies, Veronica, for jumping in like that.
No, sorry, I didn't see.
Trinity Counseling does an excellent job at, providing services to the community, and they've been around for a long time, and we work closely with them all the time.
And I would add to that, the children at Princeton Nursery School have the support of Trinity Counseling for both the children and the parents if needed. So they've been wonderful partners.
And my apologies to you, Mike, because you started speaking when I jumped in.
Yeah. I guess I would just do a follow-up question and ask both from the school's perspective and others if there's a feeling of, well, there's a problem of capacity because there's Trinity Counseling, are they able to assume to respond to the need, or there are limitations there. Is there a feeling that we don't have enough? And I know, Gary, your group is trying to expand your mental health work with.
I think there's definitely, you got to remember, we've lost some resources. There was family guidance in town. We had family and children's services that were in town. Both provided extensive services. Jewish Family and Children's Services is another resource that we can use and do use all the time for both, mental health services, and they have a variety of different programs. They also have bilingual counseling available. I think Beth just put that in the chat. So, we have lost, some major agencies, Family Children's Services, Family Guidance. That was a big hit to the community to lose both of those in the last 10 years.
Gary, do we get any kind of help from at the county or state level on the solely mental health side? Because most of the groups you're mentioning sound to me like a lot of NGO, not-for-profit type groups. I'm just wondering how much the county helps us with that.
We don't provide straight mental health services, so we don't get any resources there, but Trinity Counseling might, or Jewish Family and Children's Services might. I'm not sure, what their funding sources are.
Okay, well, yeah, when I was asking, I mean, not just for Corner House, but I'm just saying how much of mental health services does Princeton get in general? And I know it's slightly outside of the scope of what you work with, Gary, on the Corner House side.
Correct. Yeah. I think talking to Michelle Madu at the county for this team to talk to Michelle Madu or Mary Grace Billick, that would be helpful because she could give you the exact numbers, both of them.
Okay, thanks, Gary. I appreciate it.
Can I just jump in to say too, regarding Trinity? Regarding Trinity, having worked with them a number of years, yes, they have been very helpful, but they've also had limitations. So there are students who and families, if they're considered too ill or psychiatric problems that are too severe, they have not been always able to work with some of those families. Sometimes there is a little bit of a wait because they're very busy. I'm not sure at this point what their capacity is, if they have full staff or not, but there was a time, like everywhere else, there was a bit of a transition. So there was a delay in getting students involved. It is true that they take, work on a sliding scale fee for families and students. But again, they have been overwhelmed at times and have not, from my perspective, have not always been able to accommodate some of the issues and problems with some of our students and families.
And I would add to that, Lenora, one of the things we've been trying to work with them for the past 3 years is to get bilingual clinicians, right. and that they are having a very hard time securing them. We desperately need them. So they can have very, obviously honest conversations with parents in their language, and it's something that I know they have been struggling with and that we desperately need here.
Right.
And that's an issue for anybody providing substance abuse and mental health. It took us 3 years to find bilingual providers. Primarily the salaries that our agencies can afford to pay. Bilingual counselors can start at $65,000 a year. In this area, higher in Trenton, and most of these agencies we're discussing start people at around $42,000 a year. So that's a huge issue that has been around for as long as I've been in Princeton, which is 21 years, and it's been a struggle.
Can I just break in real quick? I thought it would be helpful. I know we have short time here, but to hear a little bit like from Carol, Ed, Kate, about the housing needs, rental assistance, and what do we expect after the moratorium ends? Can one of you weigh in on that, or all
Ross,
of you?
Michael never did finish speaking because I butted in the middle of what Michael was saying. So I don't know if Michael had something. I apologize, Ross, but I don't know if Michael wanted to finish what he had to say.
I was just clarifying if Veronica was asking you to speak on any mental health services that we provided. You know, as far as the ACE program goes, we refer students who kind of are, you know, either missed by, you know, certain programs or just fall through the cracks. And so, you know, the biggest thing I'll just say that we've had to work with this year, and it's actually a decent segue, is Carol helping us get one of our students and their family into housing after they lost it right before the school year started. So, but as far as any resources or anything like that, I mean, we work with Gary and Riva from Corner House. Riva's been good in the past at referring our kids to other places if they needed some help. I think we had like a gamer depression, gamer addiction / depression case. But that was about the most that we've seen as far as the ACE program is concerned. Our main focus has been more around the food security mainly. Our housing and mental health situations have been fairly stable.
Thank you, Michael. Sorry, Carol, if you want to answer Ross' question.
So the question is about rental assistance more than housing generally?
No, I think it was more about what do you think, you know, what to expect now that the moratorium is going to be ending at the end of June, and, you know, what is your...
Well, it's not ending at the end of June. It's mid-August now.
Yeah.
Middle late August, but there's an article today that that Murphy is planning, you know, hoping to end the state of emergency, which you would think would then impact the eviction moratorium. But I don't know if anyone saw this, but there's 14 measures that the Democrats want to keep in place even without the state of emergency declaration, and one of them is the eviction moratorium. So it's not clear that it's going to end in August, which is the good news. But it's, you know, people are still struggling. People are definitely still struggling to pay the rent. People are going back to work somewhat, so it's definitely not as bad as it was, and certainly in terms of the Princeton proper, the area that you guys in this call are concerned with. The applications have very much slowed down in terms of looking for rental assistance.
What's going to happen with the deferred payments? Is there going to be a balloon requirement?
Which deferred payments?
Well, like monthly rental that has been. Oh, are you only dealing with forgiveness of rent, so there's not going to be a big debt?
The people we're helping, there won't be debt. I mean, that big caveat is we could only do a certain number of months of rental assistance. So yeah, most people by the end of July, of the people we helped, will be caught up as of the end of July. Then we're out. Then we can't. We're almost done with the money. The CDBG grant is almost fully spent, and then you hope that people are working enough to pay their rent again. And the people, but I mean, just with my other hat, with Ed knows, there's just not enough housing. There's just not enough housing, period.
Yeah.
And that's the biggest problem. And I know we have a bunch online coming, Dwayne, and you know, stuff's going to start getting built, but there's those waiting lists, and Dwayne knows, Ed knows. The waiting list is ridiculous, and people there's nowhere to live.
Ed, did you have something you wanted to add?
Yeah, just briefly, thanks, Ross. And first of all, thanks to everybody on the call for all the support our residents have received from many of you. Michael, especially from Roseboro, thank you for all your help with the food assistance. And But thanks to everybody for working together to help people. That's what it's all about. I'm with Carol. I think the applications for rent relief have slowed a bit. We're still seeing some. In fact, two of them crossed my desk this morning. But Princeton Community Housing is not in the business of evicting people before the pandemic, and we're not changing that. And we've had rental assistance through Carol's organization, Felicia, through her organization at the beginning of this. And now, we have our own. So we're trying to keep, people stable and in their housing. And, people are stepping up and doing what they can based on their situations. And we're pretty much, I'm feeling pretty positive about it. I don't know that we're going to have a lot of people who are going to have significant debt when this moratorium does end. So I feel pretty good about it, but that's just a snapshot of our residents. I don't know about all the other people in the community who have suffered through this. So Carol's right too. We need more housing. We need more opportunities for affordable housing in this town and in this state. So hopefully we can all work together on that too.
Thank you.
Thank you.
Do we have any last minute observations or comments from folks, as we don't want to keep you beyond our 1 o'clock time? And also, if you didn't have a chance to say something or on reflection would like to share with us your input, Veronica is going to post the email address for Human Services, and we'd be happy to hear your comments by email, and we'll try to keep up with those responses that way as well. And I think Melissa is going to look at sharing the video with you.
So what we'd like to be able to do, gathering the conversations we've had today, plus the input you may send to us, is that add a slide to the presentation that kind of sums up some of this, the new input that you're providing, the reaction to the presentation.
Yeah, thank you. I sent the email to Erica in private. I'm so sorry. I'm glad Melissa just put it there. I will also, before we finish, I don't know if we can give an opportunity to, is Lisa Ekstrom still here? She's not there, right?
Lisa just left.
She just left.
Okay, just because we didn't hear, we hear a lot from the Princeton Public Schools, but we didn't hear anything from the charter. So, but it's fine. I mean, I can also reach out to her individually. I just want to say thank you to everybody, and make sure to send an email, because it is very important for us to hear from you, or any other comments you would like, to tell us about the presentation, or what are we missing, right? And since it's recording the presentation, we record the presentation and it's going to be available to you. At the end of presentation, there are 3 questions, right? What has changed after, after we did all the listening sessions with you? And any feedback that you have for us, or any discussions that you would like to follow, if you send us that email, it will be very helpful for us to understand, what are we missing.
And we would, just to follow up, we'll hopefully have the results of the larger survey that was conducted, and that many of you participated in as well, both in terms of trying to get our heads around who's being served in Princeton, and how also people are getting access to services and getting their needs met from the perspective of service providers. So hopefully we'll have something together with that, and we'll share what we have with all of you, as well as other folks in the community, and then figure out where to go from here. So again, please let us hear from you if you have something further to share with us. It's your participation has just been very important to us, and thank you all for the work that you're continuing to do as we go through into another phase of this pandemic as well. Hopefully things will be getting a little bit better for folks as we move forward. Thank you. And thank you for joining us today.